Go ahead.
So, good evening, everyone. I'm Dr. Sayali. I'm the junior consultant and fertility specialist at Oasis Fertility Pune at the Karadi Center. I welcome you all for today's Facebook Live session. Our topic for today is nutrition in PCOS. Now, PCOS, as most of us know, is one of the most common endocrine disorder. It is prevalent in around 3 to 20% of these women, and around 70% of the women they go undiagnosed. Now, what is PCO? PCO, that is polycystic ovarian syndrome, it presents with menstrual abnormalities. Now, these can be in the form of oligo or amenorrhea. Now, oligo or anovulation. So, when there is anovulation, there is usually the follicles fail to develop and ovulate at the right time, and therefore, this is one of the leading cause of anovulatory infertility. So these individuals they present with infertility, so there is decrease in the pregnancy rate. Because of the endocrine abnormalities, they have increase in miscarriage rate and increased risk of obstetrical complications also. Now, individuals with PCO also have features of hyperandrogenism. Now, this can manifest in the form of alopecia or excess body hair. Then on ultrasound, they have enlarged ovary or greater number of small follicles that are there, hormonal abnormalities. So in these individuals, the luteinizing hormone levels are on the higher side, or the luteinizing hormone to the FSH ratio is high, and they present with insulin resistance. So polycystic ovarian syndrome is associated with increased risk of diabetes mellitus, increased risk of hypertension, cardiovascular abnormalities. They can present with psychological abnormalities like increase in the mood swings, depression, other mood disorders, and reproductive abnormalities. And in these individuals also have increased cardiovascular risk. Now, infertility and menstrual abnormalities are usually seen in individuals who are obese or overweight, or basically individuals who have a BMI of greater than 30 kilogram per meter square. So in individuals with PCO, they usually have higher rate of weight gain, and there's an increased prevalence of excess weight in these women or adolescent individuals with PCO. Now, this is going to affect their reproductive function. This is going to affect their metabolic function as well as their psychological health. Now, PCO again comes with insulin resistance. Now, this is one of another common finding that is there. Insulin resistance is seen in like 75% of these individuals who are lean, and around 95% of individuals who are obese or overweight. And this is going to be exacerbated by the excess weight of these individuals. So more there is going to be abnormalities in the weight, the more the features of PCO are going to be more predominant. So, lifestyle interventions and weight loss benefit these individuals with PCO. Now, coming to the lifestyle intervention and reduce weight, as little as 5 to 10% of the total body weight, if there is a reduction in the weight, this is shown to have an improvement in the metabolic, reproductive, as well as the psychological well-being of these individuals. Now, what does healthy lifestyle encompass? Healthy lifestyle encompass that you should have a regular healthy eating habit, have these frequent, small meals that are there, which are taken at regular intervals with regular physical activity. Now, a healthy lifestyle includes diet, exercise, and behavioral strategies. Now, coming to the behavioral strategies first, now these individuals, they should, be setting up proper goals of weight loss and healthy eating for themselves. They should be monitoring themselves and see to it that they are following these goals. They should have self control, and they should have certain other lifestyle modifications which are going to help them achieve this goal. Now, coming to the dietary interventions, a balanced diet is recommended in these individuals, especially to reduce their dietary energy intake and to induce weight loss in these individuals, especially the individuals who have, who are overweight or individuals who are obese. Now, energy deficit in the form of at least 30% of the total calorie intake, or around 500 to 750 kilocalories of energy deficit per day. So these individuals usually, should end up consuming 1200 to 1500 of kilocalorie per day. So even this, calorie restriction will help them to achieve their weight loss goal, along with the exercise and that are taking place. Now, with a sedentary lifestyle is around 1600 to 2200, and individuals with a moderate activity it is around 2000 to 2400. So when there is a deficit of even at least 500 to 750 kilocalorie per day, they're able to reach their goals. The sources of calories. Now, these calories usually come from three main sources, that is the dietary fats, the carbohydrates, and the proteins. Now, initially coming to the dietary fats and proteins, what all is to be consumed? Now, when we have a high fat intake, now this high fat intake is associated with increase in insulin resistance, and this relationship is usually seen in individuals who are overweight or obese. So the more the weight they have, the more is going to be the insulin resistance. So reasonable fat intake. So if they have a total fat intake of around 20 to 40% of the total calorie intake, this is not going to have any impact on the insulin resistance or the obesity. Now, fat usually comes in the form of saturated or unsaturated fatty acids. Now, the saturated fatty acids that are usually seen in red meat, the processed meat, the fried foods, or the fast foods that we are taking, the aerated beverages, the desserts. Now, these saturated fatty acids, do harm to the body, and they are to be avoided. Now, coming to the consumption of unsaturated fatty acids. Now, when we consume unsaturated fatty acids, those are the monounsaturated fatty acids. This results in improvement in the insulin sensitivity, especially in individuals who are type 2 diabetic, or these individuals who are obese. So, when you compare the saturated over the unsaturated fatty acids are usually to be consumed in the diet. And in unsaturated, also we have the monounsaturated and the polyunsaturated fatty acids. So the monounsaturated fatty acids are usually preferred over the polyunsaturated ones. In the monounsaturated one, these are more easily assimilated by the body, and these are present in olive oil, sunflower, coming to the sesame oil or the peanut oil. And these fatty acids are healthy, and therefore they should be consumed. Coming to the omega-3 fatty acids, which are present in fish like the salmon or the sardines, or the seeds like the flaxseed or the chia seeds. They're present in walnuts, peanuts. Now, these also have like anti-inflammatory properties, and these are like, healthy, and therefore they should be consumed in the diet. Now, coming the calorie intake that we are taking, they should be spread in like 5 to 6 small meals throughout the day. So these individuals, they do not end up having more cravings and rise in the blood sugar levels. Now here we have dealt with the fatty acids. Now coming to the proteins. So whenever you have a high protein intake, proteins take longer time to digest, and therefore they have they maintain the feeling of satiety for longer duration. The postprandial thermogenesis is maintained, and therefore increase in the protein intake that is usually present in lean meats, the poultries, the eggs, the milk, and the milk products. Now this helps in decreasing the insulin resistance, and this helps in decreasing the abdominal fat. Coming to carbohydrates, foods. The carbohydrates, they consist of foods which have a high glycemic index and foods which have a low glycemic index. Now, what is high glycemic index? Any food which has a high glycemic index. Now, this can be in the form of cereals like cornflakes, can be the sugary or the aerated drinks that you are taking, can be the beverages or the starchy vegetables such as the potatoes, pumpkins, or any form of white bread, white rice, or maida that we are taking. Now these carbohydrates which have a high glycemic index, now these are going to get absorbed very rapidly by the body, and they're going to suddenly increase the sugar levels in the body, because the carbohydrates are going to be delivered immediately after ingestion. So, in individuals who have the risk of diabetes mellitus, or who has PCO, which is associated with insulin resistance, these in these individuals, if you have food with a high glycemic index, so these foods are going to be very rapidly assimilated by the body, and they're going to result in a very sharp, increase in the blood sugar level. So, these foods are supposed to be avoided in these individuals. Now, when we want to maintain the body's glycemic load, or when we don't want to overload the body with too much sugars, we are usually supposed to avoid these foods which have a very high glycemic index, and these can be replaced with proteins, or they can be replaced with the monounsaturated fatty acids. Now, coming to carbohydrates, which have a low glycemic index. Now, when you consume carbohydrates with a low glycemic index, now these include the green leafy vegetables, the non-starchy vegetables that are there, the legumes that you're taking, the fruits that are ingested. Now, these usually take longer time to digest. So these are like the good carbohydrates. So these carbohydrates, they get assimilated slowly by the body. They remain in the blood for a longer duration, and therefore, they maintain a sustained sugar level, and therefore these are more beneficial for individuals, who have diabetes or insulin resistance, because they result in like small and slow rise in your blood glucose levels. So, along with the fats, carbohydrates, and proteins that we have seen, other supplements also needs to be taken in individuals with PCO. And in this, we have the vitamin B supplementation. Vitamin B usually is present in foods like the sunflower seeds. They also have to increase the intake of calcium and vitamin D. Calcium is necessary for the egg maturation and the follicle development, and vitamin D is necessary for the absorption of this calcium. And it has been seen that in individuals with PCO and those who have vitamin deficiency or low vitamin D level, in these the problems of PCO or their endocrine abnormalities are exacerbated, and there is more incidence of infertility, weight gain, and insulin resistance in these individuals. And other supplements that needs to be given are zinc, magnesium, and chromium, and these are beneficial in individuals who have acne, obesity. They will be helpful in these. So, as we have seen till now, that the foods that are to be avoided in individuals with PCOS are usually the refined carbohydrates like the maida, the white bread, white rice that we are consuming. Avoid the sugary drinks, avoid the fried foods, avoid the fast foods that are present, any empty calories which are coming from your sodas or energy drinks, the processed meats that that are present in hot dogs, or the excess of red meat consumption is to be avoided, and avoid the saturated fats. So what should these individuals actually consume? So nutritional goals in PCO should be that they should have small, healthy, timely meals that should be distributed like 5 to 6 times in the day. So these will prevent their cravings. Eat diet which is good in antioxidants. Eat diet which is rich in fresh fruits, green leafy vegetables, whole grains, low fat dairy products, the beans, the legumes. Proteins which are present in lean meat, poultry, or eggs, they need to be consumed. Anti-inflammatory agents that are present in omega-3 fatty acids, that is that are present in fishes, or the fish like the salmon, the sardines, the chia seeds, the flax seeds, all these things are to be consumed. They have to limit the consumption of refined carbohydrates. They have to consume more of monounsaturated fatty acids, and limit themselves in consumption of saturated and the polyunsaturated fatty acid. Have an adequate protein intake of at least 40 to 50% in the total diet. So this will also help them in maintaining the feeling of satiety so that they do not feel hungry, and restrict their calorie requirement, calorie intake to around 1500 kilocalories. So they have a calorie deficit of at least 500 to 700. So this will help them along with the exercise to maintain a weight loss of at least 5 to 10% of their total body weight. Now we have seen about the nutrition part, but exercise along with nutrition also plays a very important role in these individuals with PCO who are aiming, for controlling their metabolic problems, and who are aiming at maintaining or reduction in their weight. So for prevention of weight gain and for maintenance of health in adults who are like 18 to 64 years of age, a requirement of 150 minutes per week of moderate activity. Now, what does moderate activity encompasses? It includes brisk walking, aerobics, swimming, cycling, or 75 minutes per week of vigorous activity. Now, this vigorous activity is going to include jogging, running, football, basketball, or swimming, or a combination of any of these. And along with this, muscle and bone strengthening activity is to be included, every 2 consecutive days of the week. And when it comes to adolescent, if they want to maintain their weight and if they want to prevent weight gain, they need at least a 60-minute per week of moderate to vigorous activity, and plus muscle and bone strengthening activity for at least 3 times in a week. And when it comes to weight loss, when these individuals want to lose weight, the adults have to focus on at least 250 minutes per week of moderate or 150-minute per week of vigorous activity, or a combination of these, along with the muscle or bone strengthening activity at least 2 consecutive days of the week. So as we know that PCO individuals are, overweight or obesity, and this in turn is going to derange their metabolic problems, and is going to cause more problems in terms of their, the endocrine abnormalities, or in terms of fertility or their psychological aspect. So adequate nutrition, understanding what the body needs and what is to be actually added to your diet, along with adequate exercise, is help is going to help these individuals to maintain their body weight and to make their PCO journey, more favorable. Um, so I think this is all that I have from my side today. I hope that the session has helped you to understand about nutrition and PCO, a little better. Okay, so we do have a few questions which I'll be answering. So, what nutrients help PCOS? So, as we have seen, that when it comes to the nutrients, the macronutrients, like you need to add an adequate amount of proteins, you need to have good carbohydrates, and you need to have good fats. In fats, you need to concentrate on the monounsaturated fatty acids because they're more healthy. You need to concentrate on the omega 3 fatty acids. Those are, like, they have an anti-inflammatory goal. An adequate protein intake of at least 30 to 40% of the daily requirement should be covered up by proteins, which comes in the form of lean meat, in the form of legumes and all that, the dairy products, eggs, and everything. And coming to the fats, you have to consume monounsaturated fatty acids. Along with this, the other nutrients that needs to be added is you need to add in zinc, magnesium, chromium. You need to add in calcium, vitamin D, and vitamin B supplementation. Okay. Now the next question is, what food is to avoid if you have PCOS? Now, as we have already discussed in our session, the foods that provide us empty calories, that is in the form of these sugary beverages, the aerated drinks, the soft drinks that are present, the bakery products, the products which are very high in saturated fats, like your fried items, the fast food items, all of these should be avoided. You should avoid red meat, you should avoid processed and packaged food items, and concentrate on healthy eating, concentrate on consumption of lean meat, concentrate on consumption of the fishes, and you know uh, taking in low fat dairy products. All of these could be consumed, and other things to be avoided. Okay. Now the next question is, what is healthy lifestyle for PCOS? Now, as we have seen that healthy lifestyle, it encompasses a variety of things. First, it includes proper daily exercise. Now the exercise should be tailored such that if you fall in the adequate BMI, then you should avoid weight gain, and therefore you require proper fat burning exercises, along with calories, so that we have gone through, that should be taken. And behavior therapy is also one of the thing. In behavior intervention, whatever goals you're setting for yourself, you should be able to follow them. Having these small timely meals, having them at the right time, having the right type of food, and supplementing that with little bit of exercise. This is the healthy lifestyle. Avoid smoking, avoid alcoholism, have proper adequate sleep. That is something that is going to help you in PCOS. Okay. So So the next question is, does PCOS need protein? Yes, PCOS definitely needs proteins. Proteins in the form of lean meat, be it your legumes, be it your eggs or poultry products, be it your milk and milk products. In the rate of at least 30 to 40% of your daily calorie intake should be proteins. Proteins stay in the body for longer time. They give a feeling of satiety, and they are the main building blocks in our body. And therefore, protein supplementation should be done in PCO individuals. Okay, so thank you everyone. I hope the session has been of some benefit to all of you. I will like to conclude my session out here. And if you have any doubts regarding today's topic or any other help needed, then you can, dial the helpline number that is given below, or you can reach us physically at any of our two center, that is Oasis Fertility at Kaspate Vasti at Vakad or Arasa Avenue at Kharadi. Thank you.